Hey everyone, welcome back to the channel. I'm Dr. Raina, and today I want to talk to you about something that is literally affecting millions of seniors right now. And I mean millions. If you're over 50, or if you have a parent or grandparent over 50, you absolutely need to watch this video, because what I'm about to share with you could genuinely change the way they walk, the way they feel, and ultimately their quality of life. So here's the thing. I've been practicing in health and wellness for quite a long time now, and I cannot tell you how many seniors come to me with the same complaint. They say things like, Dr. Raina, my legs feel heavy, or I can't walk as far as I used to, or my personal favorite, my legs just don't feel like they're getting enough blood flow. And honestly, it breaks my heart every single time, because most of the time these people have been told that this is just a normal part of aging. That's it, that's all they get. You're getting older, so your circulation is getting worse. Sorry, that's life. But that's not actually the whole story, and that's not acceptable to me. Now, before I jump into what that one vitamin is, I want to be really transparent with you because I know there's a lot of misinformation out there. I know that people talk about magnesium all the time. Oh, you need magnesium for circulation, you need magnesium for your muscles, you need magnesium for everything. And look, magnesium is important. I'm not going to sit here and tell you that magnesium is useless, but when it comes to specifically restoring leg circulation, when it comes to that particular issue, magnesium is not the primary answer, and that's actually what Barbara O'Neill, who's this incredible researcher and practitioner, has been pointing out for years, and I think she's onto something really important that we need to talk about more openly. Let me paint you a picture of what's actually happening in the bodies of these seniors that we're talking about. When you hit a certain age, your blood vessels start to lose their elasticity. Think of them like old rubber bands, right? A new rubber band stretches beautifully, it's flexible, it does exactly what you want it to do. But an old rubber band, you stretch it and it's not quite the same. It's stiff, it doesn't bounce back the way it used to. That's what happens to your arteries and your veins as you get older. And when your blood vessels become less elastic, when they become stiff and rigid, the blood flow to your legs specifically becomes compromised. Your legs are the furthest point from your heart. Think about that for a second. Your heart is pumping blood all the way down to your toes and then back up again. That's a journey, that's work, and if your blood vessels are not in optimal condition, if they've lost their elasticity and their ability to expand and contract efficiently, then guess what? Your legs are the first place where you're going to feel that problem. You're going to feel heaviness. You're going to feel fatigue. You're going to notice that walks that you used to take without thinking twice now feel exhausting. Now here's where the vitamin I want to talk about comes in, and this is really important. The vitamin that Barbara O'Neill and other brilliant practitioners have been highlighting is niacin. That's right, we're talking about niacin, also known as vitamin B3. And before you think, oh, B vitamins, I've heard about those before, hear me out, because the specific way that niacin works for leg circulation is actually pretty remarkable, and it's something that many people don't fully understand. Niacin does something really specific in your body. It acts as a vasodilator. Now, vasodilator is a fancy term, but it basically means it makes your blood vessels wider. It helps them expand. Think about it like this. If you have a hose that's connected to your faucet and the water is coming out in a tiny little trickle because the hose is all squeezed and pinched, what happens if you loosen that hose? More water flows through, right? That's what niacin does to your blood vessels. It helps them open up. It helps them expand. And when your blood vessels are more open and more expanded, more blood can flow through them, which means more oxygen, more nutrients get delivered to your legs. But here's the thing that really fascinates me about niacin, and this is backed up by actual research, not just anecdotal evidence. Niacin specifically improves the function of your endothelial cells. Now, what the heck are endothelial cells? Well, your blood vessels are lined with these incredibly important cells called endothelial cells. These cells produce something called nitric oxide, and nitric oxide is like the master key to healthy circulation. Nitric oxide tells your blood vessels to relax and expand. It prevents blood clots from forming. It reduces inflammation in your blood vessels. It's basically the most important molecule for cardiovascular health that most people have never heard of. And here's the beautiful part. Niacin helps your endothelial cells function better. It helps them produce more nitric oxide, so you're not just getting a temporary boost in circulation, which is nice, but you're actually improving the underlying function of your cardiovascular system. You're getting your blood vessels to work better. You're improving their ability to produce this crucial molecule called nitric oxide. That's the difference between a Band-Aid solution and an actual solution. Now, when Barbara O'Neill has talked about this, she's been discussing how seniors specifically can benefit from niacin, because as we age, our natural nitric oxide production declines. It just does, and that's part of the aging process. But here's the good news, and this is what I really want you to understand. You can support that process. You can help your body maintain and even improve its nitric oxide production with the right nutrients and the right compounds. And niacin is one of the most important ones for this. There are different forms of niacin, and this is important to know. You've got nicotinic acid, which is one form, and you've got nicotinamide, which is another form. Some people respond better to one form than another. Nicotinic acid is known for that flushing effect that some people talk about, where you feel your skin getting warm and turning a little bit red. That's actually the vasodilation happening. Some people kind of like it. Some people find it uncomfortable. So there are different options out there, and your body might respond better to one than the other. When you're looking at dosages for niacin, especially for the purpose of improving leg circulation, we're typically talking about something in the range of 500 to 1,000 milligrams per day. Now, I want to be really careful here because I always tell people to work with a healthcare provider before starting any new supplement. I'm sharing information with you, but I'm not telling you to go out and self-diagnose and self-treat. Every single person's situation is different. Everyone has different health conditions. Everyone is on different medications, and some of those medications might interact with niacin. So please talk to your doctor first. That's important. But what I will tell you from my experience working with seniors is that when people start adding niacin to their routine and they do it properly, many of them start noticing improvements in their leg circulation within a few weeks. I'm talking about 2 to 4 weeks. They tell me that walks feel easier. They say that their legs don't feel as heavy. They notice that they can walk further without that sense of fatigue and that heaviness that was really bothering them. And some of them have even told me that their legs feel warmer, which makes complete sense because they're actually getting better blood flow to them. Now, the way that niacin improves circulation goes even deeper than just the vasodilation and the nitric oxide production. It also helps to improve your blood lipid profile. It helps to improve your cholesterol and triglyceride levels. And this is relevant to leg circulation because if you have elevated cholesterol or elevated triglycerides, that affects your blood viscosity. That affects how thick and sticky your blood is. And thicker, stickier blood doesn't flow as easily through narrow blood vessels. So by improving your lipid profile with niacin, you're also making it easier for your blood to flow through your vessels, especially those smaller vessels in your lower legs and your feet. There's also something really interesting happening with niacin and inflammation. Poor circulation is often tied to vascular inflammation. Your blood vessels are inflamed, and that inflammation contributes to their stiffness and their inability to function properly. Niacin has anti-inflammatory properties. It helps calm down that inflammation. So you've got the vasodilation happening. You've got the improved nitric oxide production. You've got the improved lipid profile. And you've got the anti-inflammatory effect all working together to improve leg circulation. Now, I want to address something that I think is important. You might be wondering, Dr. Rena, if niacin is so great, why doesn't my doctor tell me about it? And that's a fair question. Part of the reason is that many mainstream doctors are focused on treating the symptoms or the disease rather than addressing the underlying nutritional deficiencies that might be contributing to those problems. That's not a criticism of doctors. It's just how the system is structured. Medicine, by and large, is trained to find a disease and prescribe a drug to treat that disease. It's not always trained to say, okay, let's look at this person's nutritional status and make sure they have all the nutrients they need for optimal health. That's where practitioners like Barbara O'Neill come in. That's where people like me, who are really interested in functional health and nutritional medicine, come in. We're asking different questions. We're saying, what does this person's body need to function optimally? What nutritional deficiencies might be contributing to their symptoms? And when you start asking those questions, niacin for leg circulation becomes really obvious. It becomes clear that this is something that should be part of the conversation. Here's something else I want you to think about. Your body has a natural preference. It wants to have healthy circulation. It wants blood to flow properly. It wants oxygen to reach all your tissues. That's the default setting. The problem is that as you age and as you develop certain lifestyle habits, you move away from that default setting. Your blood vessels become less elastic. Your endothelial function declines. Your nitric oxide production decreases. But here's the beautiful part of this conversation. You can move back toward that default setting. You can improve these things. It's not permanent. It's not irreversible. Your body wants to heal. It wants to function well. You just have to give it the right tools. And that's exactly what niacin does. It's one of those tools. It's a key nutrient that your cardiovascular system needs to function optimally. And when you have adequate niacin, when you're getting enough of this vitamin, your blood vessels work better. Your endothelial cells produce more nitric oxide. Your circulation improves. And that means your legs get better blood flow. That means they feel less heavy. That means you can walk further. That means you can do the activities you love without that constant sense of fatigue in your legs. Let me give you a real-world example of what I'm talking about. I had a patient named Margaret. She was 73 years old. She came to me complaining that she couldn't walk more than about 15 minutes before her legs started to feel really heavy and fatigued. It was affecting her quality of life. She couldn't walk with her grandchildren. She couldn't visit the farmer's market like she used to. It was really impacting her. We looked at her diet and we looked at her nutritional status and we noticed that she wasn't getting adequate niacin. So we supplemented her with niacin and we also made some dietary changes to improve her overall cardiovascular health. Within 3 weeks she was walking for 30 minutes without that heaviness. Within 6 weeks she was walking for 45 minutes. She came back to me with the biggest smile on her face and said, "Doctor, Raina, I can walk with my grandkids again. That's what this is about. That's why I'm talking about this." Now, if you want to get niacin from food sources, that's always a good place to start. Chicken, turkey, tuna, salmon, peanuts, mushrooms, green peas, these are all foods that contain niacin. But here's the reality. Many seniors are not getting adequate niacin from food alone. And sometimes food sources aren't enough to get the level of niacin that you need to really make a difference in circulation. That's where supplementation comes in. When you're choosing a niacin supplement, you want to look for a reputable brand. You want something that's been tested for purity and potency. You want to start with a lower dose and gradually work your way up because your body needs time to adjust to it. And again, work with a healthcare provider. Get blood work done. Monitor your cholesterol and your triglycerides because niacin is going to improve those things and you want to see that improvement documented. Let me also say this about leg circulation and aging. It's not just about the one vitamin. Niacin is incredibly important and it's probably the single most important nutrient for leg circulation in seniors, but it's part of a bigger picture. You also want to make sure you're getting enough movement. You want to walk, you want to do some kind of physical activity that gets your blood moving. You want to make sure you're staying hydrated because dehydration thickens your blood and makes circulation worse. You want to make sure you're eating a diet that supports cardiovascular health, plenty of vegetables, healthy fats, lean proteins. You also want to think about things like stress management because stress constricts your blood vessels. When you're stressed, your blood vessels tighten up. Your heart rate goes up. Your blood pressure goes up. Over time, chronic stress damages your endothelial cells. So managing your stress is part of optimizing your circulation. Maybe that's meditation. Maybe that's spending time in nature. Maybe that's yoga. or Tai Chi, or just taking time to be still. Whatever it is for you, that's important. And sleep. Oh my goodness, sleep is so crucial for cardiovascular health. When you sleep, your body is doing all kinds of repair work. It's managing inflammation, it's optimizing your endothelial function, it's preparing your cardiovascular system to work optimally the next day. If you're not sleeping well, you're not giving your body the time it needs to repair and optimize. So getting 7 to 9 hours of quality sleep, that's part of this equation too. But niacin specifically is the nutrient that I want you to focus on for leg circulation. It's the one that Barbara O'Neill has been highlighting. It's the one that research supports. It's the one that I've seen make a real difference in my patients' lives. Here's what I want you to do right now. If you're watching this and you're over 60, or if you have a parent or a grandparent who's dealing with poor leg circulation, I want you to talk to your doctor about niacin. Bring up this conversation, print out some research if you need to. Ask about your niacin levels, see if supplementation might be appropriate for you. And if your doctor is open to it, which many will be because this is pretty well established in the research, then consider starting a niacin supplement. The beautiful thing about niacin is that it's affordable, it's accessible, it's safe when used appropriately. It's not some exotic compound that you have to hunt for. It's a B vitamin that your body needs anyway. So the fact that it specifically improves leg circulation is kind of a win-win situation. I also want to mention that some people combine niacin with other circulation supporting strategies. For example, some people use niacin along with CoQ10, which is a molecule that supports mitochondrial function and heart health. Some people combine it with omega-3 fatty acids, which help reduce inflammation and support cardiovascular health. Some people use it with exercise and diet changes. The point is, niacin doesn't have to be the only thing you do, but it should definitely be part of your strategy if you're dealing with poor leg circulation. And here's something that really moves me. I think about all the seniors out there who are suffering with this problem, and they don't know about niacin. They don't know about the research. They don't know that there's something they can do about it. They've been told that this is just part of getting older, and they've accepted it. But that's not necessarily true. There's so much you can do to improve your circulation at any age. Think about the implications of that. If a senior can improve their leg circulation, if they can walk further without fatigue, if they can be more active and more independent, what does that do for their quality of life? What does that do for their mental health? What does that do for their ability to engage with family and friends? It's huge. It's life-changing. That's why I'm making this video. That's why I'm talking about niacin so passionately. Because I believe that every senior should have the information they need to optimize their health. And if niacin can help restore leg circulation, if it can help someone walk further and feel better and live more fully, then that's something that should be part of the conversation in every doctor's office. So I want to wrap up by saying this. If you're dealing with heavy legs, if you're dealing with fatigue in your legs, if you're dealing with poor leg circulation, please don't just accept it as a normal part of aging. Please don't just assume that there's nothing you can do. There are things you can do. Niacin is one of them, and it might be the thing that changes everything for you. Before you go, I want to ask you to do 2 things. First, if you found this information helpful, please like this video and subscribe to the channel because I'm putting out new health and wellness content all the time and you're not going to want to miss it. Second, if you have a family member or a friend who's dealing with poor leg circulation, please share this video with them. You might be changing their life. You might be giving them the information they need to take control of their health. And finally, talk to your doctor. Work with a healthcare provider. Get your blood work done. Monitor your health. Make informed decisions. That's always the best approach. I'm Dr. Rena, and I'll see you in the next video. Thank you for watching.